What have been the most significant developments in the treatment of hepatitis C during the last year?
So for me, the most important new findings and understandings of hepatitis C and treatment in the last year have been focused, I think, on two areas. One is how the disease impacts patients, both in terms of morbidity and mortality, and also how treatment then impacts patients' lives. So I think there's some very interesting data that was published this year showing that Hep C patients have lots of problems outside the liver. So these are called extrahepatic manifestations of liver disease. And so Hep C is now being thought of as a systemic disease that impacts both the liver, but it also impacts cardiovascular disease risk, it impacts diabetes, it impacts overall quality of life in terms of fatigue, ability to enjoy pleasure, and go to work. So this year what we saw was a number of studies that looked at the impact of treatment on some of these comorbidities. And in a very large VA study, there was a separation of people who were cured versus those who weren't. Those who were cured actually had much improved survival, but it wasn't related to purely liver-related complications. So clearly we know liver patients have increased risk of cancer, increased risk of decompensation, death, need for transplant. And we know that if we cure people, those outcomes will improve and will drop cancer rates, say, 100-fold. So we've known that for the last 5-6 years. What's new this year is that by curing Hep C with the current therapies and more excitingly with the new therapies, we have a chance to impact non-liver related disease. And so what we've seen this year is evidence that by successful treatment of Hep C, we can decrease overall mortality rates, we can decrease the development of diabetes, we can decrease cardiovascular risk. So I think it really comes to fruition when talking to a patient about treating patients now or waiting for new therapies. And I think the typical paradigm has been we will treat patients with advanced disease now because they're at highest risk for bad outcomes. To me, this new information that Hep C is a systemic disease, that it can be treated successfully, especially with the current therapies, even more successfully in the future, will allow us to really target, I think, a broad population, knowing that we're going to impact survival not just in patients with advanced liver disease. So I think that really is helpful in a discussion with a patient, knowing that even mild fibrosis patients with an appropriate treatment outcome, which is an SVR, will enjoy improved quality of life as well as survival. So obviously the biggest development in Hep C therapy have been the development of new direct-acting antiviral agents. Telaprevir and boceprevir were approved, it seems hard to believe, less than 2 years ago, and we've offered patients now a great new opportunity to be cured, with, for untreated patients, cure rates up to 75%. For treatment-experienced patients, cure rates somewhere between 20 to 50% based on their interferon responsiveness. So that is a major advance from where we were 2 years ago. The major developments, though, I think are the most important, is that we now know that hepatitis C can be cured without interferon. We've debated that question for over a decade, and we have seen clear evidence now in large phase 2 and phase 3 trials that you can cure patients without interferon. The reason this is so important is because the majority of patients with Hep C have not undergone therapy, mainly due to the perceived and real side effects of interferon-based therapy. And so the fact that we can now potentially offer patients good therapy with high cure rates without the need for interferon, I think will really change the discussion, not to who should we treat, but as I think eventually these new drugs will allow us to treat the most patients who present to our practices. It really helps change the discussion now to we need to diagnose patients and get them access to care. I think specifically we know that in the fall of 2013 we'll see the first approval of an all-oral regimen with a new nucleoside inhibitor plus ribavirin. But really within the next 1 to 2 years we'll see broad regimens now being able to be applied to hepatitis C patients. So clearly this is, I think, in most of our minds, the beginning of the end to hepatitis C. We're going to have treatments for almost all patients, regardless of their comorbidities, and we'll be able to really personalize medical care in terms of interferon-containing regimens for certain populations and interferon-free populations. And so I think it's a very wide open field for hepatitis C.